So I talked to a virologist not too long ago. I talked to him twice. And
Kenneth,
yes.
I know him. Yeah.
And so, but we were talking about, we dabbled in the first time we talked cancer a little bit. I don't know that much about cancer, but I know that it's a mutation that kind of just keeps jumping, right? Just give me and everybody else a little background on what cancer is. And you said like why it occurs. What did you find that why it occurs, in society so much?
Yeah. So, I mean, cancer is really a disease of old age. And so, for an analogy that kind of makes sense to everybody is that, you got a car for a long time. No matter what you do, you just drive things get old and they break. Well, so that happens inside of cells too. As you age, the cells get replenished, but they also age. The cells age as well. And things just don't work the same. The systems in the body don't work the same. And so mutations occur and they build up, and eventually mutations occur in genes that are important for stopping cells from becoming cancers. And then once those genes are mutated, then the cell just proliferates. Essentially, it's called transformation, and cells transformed, and then it just proliferates uncontrollably. Because at that point, cells in your body kind of understand that they're cells in the body. They know that they're part of this greater infrastructure that makes up an organism. The cancer cell doesn't give a fuck about that anymore. It is like, I want to survive. I'm going to do things that help me survive in whatever environment I'm in. And so, yeah, so we realize that, most of these things are just what we call stochastic, meaning that they happen randomly because people are old. And some of that is the cells, and also some of that is the immune system. The immune system normally keeps cancer cells in check, kills them when it realizes it's a cancer cell. But as you age, your immune system starts to fail. It gets less diligent, it gets less effective. So there's kind of like a perfect storm of things that occur, and that's why people get cancer mostly. Also, things can give you cancer. Smoking, alcohol,
The
toxic
sun.
chemicals, sun. And there's nothing special about the sun specifically. The sun is just a giant energy source, and it emits UV rays, right? And those UV rays hit cells and create these things called pyrimidine dimers, which essentially you take two nucleotides, which are the letters of the genome, and the energy literally fuses them together. It creates a covalent bond, and that's called a pyrimidine dimer. And so when those two nucleotides fuse together, they make a little bridge, and then the machinery that's supposed to read the DNA and then duplicate it and all that stuff doesn't understand what to do with this. And so that can cause repair mechanisms to come, try to fix it, and sometimes it fixes it incorrectly, and then that's a mutation. And then kind of go down this mutational cascade where that cell can then turn into a tumor cell.
Yeah, and cancer is fascinating because like you said, it is like an old age disease, but it happens. It could happen in anyone, and the one that's the
Yep.
saddest the most is little kids. When they get cancer. Do we know why it is? Why is it just because of that? What you said, just like maybe some things gave them cancer, like microwaves and things like that. I know South Park. I'm getting my information from a TV show. So
No, they don't. Not to worry about microwaves. But so kids actually, this is gonna sound not weird, but kids they only get a few different types of cancer. Um, they get things like, and mostly it's because of genetic predisposition.
mm,
Like they inherited some rare genetic disease that increases their cancer susceptibility. Um, or they get, leukemias, they get sarcomas, they get osteosarcomas. Sarcomas are cancers of the soft tissue, like muscle
oh,
cancers and
okay.
stuff like that. Um, Osteosarcomas are bone cancers. Kids get that. Teenagers get that. And then kids get leukemia, all the time. But we're really good at curing leukemia in children. Actually, they do really well on treatment.
Really? Why is
So
that?
childhood, we think it's, so leukemia is a blood cancer. And what happens is when what we think, we don't really know. What we think is that the bone marrow is young, essentially, and to kill the cancer, we essentially have to get close to eliminating a person's bone marrow and killing the cancer cells. And we think that children, because the bone marrow is young, because they're young, they bounce back their bone marrow bounces back really well
Mm,
from, that the chemo and radiation and all those things. And also, kids are young, they're healthy mostly. They don't have any comorbidities or diseases that are also occurring with their cancer. Like old people have like cardiovascular issues because they're old as hell, and then they have cancer. So then like the drugs that would make cardiovascular issues worse, you got to really pay attention to that in old people. But in little kids or in adolescents, they don't have any other diseases. They just have the cancer. And so it allows you to kind of treatment intensify, and they just do better on therapy. And so they have a higher cure rate. Also, leukemias in general, if caught early, have a pretty decent cure or remission rate. So some, and again, cancer is like a big term. So some cancers we have really great treatments for, and some cancers are a fucking nightmare.
What's the worst cancer to get if you had I heard pancreatic's pretty bad, right?
So that's my PhD focused on pancreatic cancer as the disease model. It's a nightmare. There's just not a lot of therapies that work. Like if you get diagnosed with pancreatic cancer today, you're probably going to live for like 15 to 18 months.
That's insane. And why is that?
Like on average. Well, mostly because most of the patients that get diagnosed, they have metastatic disease, meaning that it's already spread to other organs. And that's because we don't have any screening or blood tests or anything like that to help detect pancreatic cancer. So usually a patient comes in, they have jaundice, which is a yellowing of the skin and the eyes, or they have some bowel pain, or there's some blood in the stool or something like that. And they're like, okay, I need to go to the doctor. And then it's like, okay, well, like a lot of different things can cause, the pain and the blood in the stool thing. And so then eventually we get to a point where it's like, okay, let's do like a CT scan and look at your pancreas. And then, we do a CT and it's all over the place, followed by PET scan, and then really see so it's already advanced. And because it's advanced, it's harder to treat. That's true for all cancers. Once it's spread, it's just harder to treat. And then there's not a lot of drugs that work. For some reason, pancreatic cancers are chemo-resistant, meaning that chemotherapy just doesn't work as well. And we don't have targeted therapies for pancreatic cancer like we do for other tumor types, like breast cancer or lung cancer, for example.
Breast cancer is gnarly. Breast cancer is gnarly too, because if you catch it, the chance of survival is high, right? But if it comes back in remission, it's like the chance of mortality is really high, right?
That's with every cancer though. You catch it early, and it's like, woman does like a mammogram, so they'll have a lump, and they do a biopsy, and they're like, that's cancer, we're going to take it out, and give you some chemo and some surgery, and really good survival rates. But a lot of people still relapse, meaning that the cancer comes back. And when the cancer comes back, it's usually harder to treat.
Why? Two questions. Sorry. One, why does the cancer come back? Do we know why? And second, why is it harder to treat once it comes back?
So the answer to your first question is the lump, the tumor that we visualize, that we could see with our naked eye, is like millions of cells, right? But you only need one cancer cell to restart that tumor. So when you do surgery, what they call complete resection, it means that they got all of the tumor that they can visually see, and then they take the surrounding area of the tumor, what they call the margins. So negative margins means they've gotten all that area, and then there's pathology to look. Is there any cancer cells around the area that we took? And that's called like a complete resection. Still, that's not good enough to know if there's one cancer cell that made its way to the bone and it's just chilling, and then 6 years later, it's grown enough for it to be a tumor again. And again, most patients come back with some symptom, and the symptom is because there's a mass growing in a place it shouldn't be. There are relatively few cancers that we have like blood tests for from a detection perspective, or like screening or something like that. Prostate is one of them. Breast cancer is another one, but it's not blood tests. Like we're literally checking for lumps. So there's just not a lot, unfortunately. To answer your second question, why is it more resistant, is because that cancer has undergone some level of treatment. It survived for whatever reason. It not only survived because it wasn't in the surgical area, it usually probably survived because it was resistant to the therapy. But because it's one cell, it takes a long time for it to grow back. And so now that it's grown, from that one cell to hundreds of millions of cells again, and the tumors, then you can't use the same therapy again. You got to use different therapies. And sometimes those different therapies are just not as effective.